She swallowed some of my husband's blood pressure pills a little over an hour ago. I did not know how many.
When did she turn this color?
Just a few minutes ago.
Okay, go ahead, let me take her. I'm going to get her into a room and get her set up. There's a chair right over there. Take a seat for me.
I need some help in here.
Okay. Crystal, I need ventilations. Megan, Lindsay, go ahead and get an IV set up for me and draw labs. Benita, we're going to need the defibrillator, the monitor set up, and go ahead and get the Boslow tape.
I'll record.
Okay, perfect.
All right, guys, what's going on?
All right, the mother states that her daughter swallowed some blood pressure medication about an hour ago. She's very lethargic and only responding to pain. Her pulses are weak and regular, and her heart rate is about 48 per minute.
Respirations are shallow with bilateral inspiratory and expiratory rhesus. And the rate is 6 per minute. O2 stats are 79 room air, 96 with assisted ventilation. And I'm having a lot of difficulty ventilating the patient.
Monitor is showing a sinus bradycardia with a rate of 48.
Her heart rate is rising with O2 and ventilations. I'm going to start chest compressions.
Okay, time starting for CPR.
1, 2, 3.
Capillary refill is 4 to 5 seconds. Extremities are cool and pale. I don't feel peripheral pulses. Blood pressure is 66 over 34. Broslov tape indicates the toddler is 12 kilograms. Okay, continue with the chest compressions. And Megan, would you check the blood sugar for me? And Lindsay, can you draw some labs and hang LR for me as well? It seems like she's in decompensated shock. So could you also prepare and give the first dose of epi, which is 1.2 mils?
Preparing 1.2 mils of 1 to 10,000 epinephrine in a 5 milliliter saline flush.
Okay. I'm Dr. Mackler. Can you tell me what happened? Oh, it's so sad. I was working in a laundry room, and I was folding clothes out of the dryer, and before I knew it, her name is Tabitha. Tabitha, okay. She called up and got my husband's blood pressure pills. In fact, I brought them. Thank you. And she had got the lid off and taken I don't know how many, and I turned around and she was on the floor and unresponsive, and I tried to get as many pill fragments out I could, and so I called my neighbor and he brought us over here. Okay, does she have any allergies? No. Is she on any medications? None. What's her past medical history? She's been healthy. She's a healthy 2-year-old. Okay. What about her weight? Last time we weighed her at the doctor, she weighed 26 pounds, 4 ounces. Okay, shots are up to date? Yes. Okay. And what did she eat last? About 3 hours ago, she had some cereal and fruit and milk. Okay. And you said this happened over about an hour ago? Yes. Okay. Thank you.
22 gauge IV started in the right AC. There was no response to pain. Labs have been drawn. LR bolus started. That's 240 milliliters, which is 20 milliliters per kilogram, and epinephrine 1.2 milliliters given IV push and was flushed with normal saline of 5 milliliters.
Her blood glucose reading is 30. Well, let's give her some 6 grams of D25 with an IV push.
Preparing 6 grams of D25.
6 grams D25 given. Flush with normal saline, 5 milliliters.
Okay, well, it seems like she's taken an unknown amount of an extended release beta blocker. We can't gastric lavage her because it's been over about an hour, and her level of consciousness isn't that great, so she's at a very high risk for aspiration. And we can't give her activated charcoal either because her bowel sounds are hypoactive.
It's been 2 minutes. Let's stop CPR and reassess.
She's unresponsive and her heart rate is 50. Monitor showing bradycardia, and it looks like she's developed a heart block.
Her O2 stats are 95%, but her lung compliance is worsened. She's getting harder to ventilate even after repositioning the airway.
Continue with the chest compressions.
Time starts.
Let's give her an albuterol nebulizer. It needs to be attached to the ventilation device so that you can still keep giving her some positive pressure ventilations. And we'll hold off on intubation until she's a little bit more stable.
It's been 3 minutes since the first dose of epi.
Let's hold the epi and give her some atropine. The dose is 0.24 milligrams. And also, Lindsay, go ahead and start a second bolus of fluids after the first one is done, please.
Preparing atropine, 0.24 milligrams and 5 milliliters saline flush.
Atropine, 0.24 milligrams given. IV push, flushed with normal saline.
Her blood sugar is now 94.
Okay, do you have the labs back yet?
in metabolic acidosis, and she's showing signs of hypoperfusion. Her potassium is elevated, her calcium is low, but that's expected with beta blocker toxicity. But since her blood glucose is over 60 now, we can give her some glucagon. It's the antidote for beta blocker toxicity. So let's give her a bolus of 0.6 milligrams IV, and then can you start an infusion of 0.84 milligrams per hour? Megan, can you double check the dose for me as well, please?
Preparing a glucagon bolus and infusion.
Giving glucagon. It's been 2 minutes. Let's stop compression, reassess.
Okay, how's her airway and ventilations?
Airway is clear and patent. O2 saturations are 97% with positive pressure ventilations, and albuterol nebulizer is in progress. She's getting easier to ventilate.
What about her pulses?
Her pulses are weak, irregular, and her heart rate is 58 per minute. I'm going to go ahead and check her lung sounds. Her lung sounds are diffuse, and she's wheezing.
Monitor is showing a bradycardia with an AV block. There's a prolonged PR interval. Rate is about 58 to 60 minutes. Capillary refill remains about 4 seconds. BP is 68/40, and she is unresponsive.
Yeah, it looks like it's second degree AV block type 1 when her heart rate is about 60. So continue with the chest compressions.
Okay, time start. It's been about 3 minutes since our last dose of atropine.
Okay, let's give her a second dose of atropine before we start the glucagon, and that's 0.24 milligrams.
Preparing atropine, 0.24 milligrams, and saline flush.
Giving atropine, 0.24 milligrams. Flushing with saline at 5 milliliters.
And don't forget the glucagon as well.
Oh, 0.6 milligrams of glucagon given, and it's at 0.84 milligrams per hour.
Should we get the dose of calcium chloride? She's hyperkalemic and hypocalcemic.
Oh yes, you're right. Let's give some calcium chloride, 240 milligrams, please.
Calcium chloride given, 240 milligrams. Okay, it's been 2 minutes. Let's stop and reassess.
Airway remains clear and patent. O2 saturations are about 98%, and there is no resistance with positive pressure ventilations. Chest rise is equal and symmetrical. She's breathing on her own, but the rate is 8 per minute.
Her pulses are stronger and irregular. Her heart rate is 68 beats per minute. Blood pressure is 72/45. The lung sounds are scattered, expiratory wheezing. Her capillary refill is about 2 to 3 seconds. Her extremities are cool, and she remains unresponsive.
The monitor is showing a bradycardia with a second degree AV block type 1. Her rate is 70, and her rectal temperature is 98.9 degrees Fahrenheit.
Okay, let's resume CPR, and we're going to have to intubate. Can you get the equipment ready for me, Lindsay? I'll need a 4.5 ET tube and a number 2 straight laryngoscope blade. And we're also going to start some dopamine once our intravascular volume is adequate. Let's titrate it for urine output of 2 milliliters per kilogram per hour.